Joan, welcome back to Floor Talk. It's great to have you on the show.
Thank you so much for having me back. It's quite an honor.
So, Joan, Travelers Institute concluded its 15th anniversary celebration by ringing today's opening bell and hosting a symposium here at the New York Stock Exchange. So, Joan, can you talk about how the Institute has changed over the past 15 years?
First of all, a big shout out to our CEO, Alan Schnitzer, for his vision and his leadership to want to build a world-class public policy think tank. But we're not just a think tank, we're a do tank. And so we put out lots of thought leadership pieces, writing, but we also do a lot of things in the community. So we've been to more than 200 cities in the last 15 years. We've hosted more than 1,000 events. So today we had about 200 people here joining us on this great day. And we had more than 1,000 across the country in the last 15 years. So we talk about public policy issues, societal issues, of course, insurance issues, and we try to solve problems. That's what we're about.
Now, you just launched a new initiative called Forces at Work. What is this campaign?
So Forces at Work really does recognize the stress and the workplace, the labor market shortages, everything you can think about with regard to an employee's well-being. So an employee well-being, mental health, we talk about physical health, we see in our workers' compensation business line every day that people are struggling in this environment. And so we try to provide those tools, the manager training, which is so critically important. You know, your manager has more influence on your well-being and your happiness than your doctor you see once a year. And so we set out a big campaign to raise awareness about some of the things that are facing employees.
Now, you mentioned mental health. It's one of the topics that you talked about today. Can you share what you learned from today's speakers?
We had the U.S. Surgeon General, Dr. Jerome Adams, and he walked us through a number of shocking statistics out there. 1 in 6 Americans suffer from a mental health crisis, or it's not just one label. He called it a spectrum of whether you're feeling bad this day or deep depression. There's a spectrum of how we feel about ourselves. And so we try to raise awareness about these worker health issues to have a more productive, engaged, highly productive and efficient workforce. And so because we see it in our data, our workers' compensation data, we decided to take on this issue head on. And so we're not afraid to talk about it. We want to shadow the stigma of mental health crisis.
Now, Joan, we both work in a high-stakes industry. What are some ways employers can support their employees' mental well-being?
Anybody can do this, right? You ask someone, how are you doing? Are you okay? And to say it's okay not to be okay. Model the way. Take your breaks. Take your vacations as a manager. Don't call people on the weekends, right? Respect their personal time. I may send you an email as my employee on a Saturday morning. Don't get back to me until Monday. Like I tell my people, the boundaries are there. Also, there's a lot of other things you could do with the workforce in terms of having people feel engaged and supported. Right? And so making sure you know your employees, have those one-on-one meetings and ask them how they're doing. Know their families. You don't have to get personal. You don't have to get into someone's private, situation, but know if there's a change in their behavior. Say someone who was always punctual is coming in late, right? Notice if they're dressed differently. They don't care about their appearance or, other things that these are signs out there that we just need to be much more aware about.
All right. Well, Joan, always wonderful to talk with you.
Awesome.
Thank you for joining me today.
Maybe I'll see you in another 5 years. Thank you so much.
I would love that.